Welcome back to Perspectives Media. My name is Damar Jackson and I'm your host. So tonight we have a very special guest on the show. Our first female guest, the one and only Shevanne. So Shevanne, introduce yourself to the people.
Good evening, everyone. I'm Shevanne Nisbett, and it's a pleasure to be on the show this evening.
All right. So who is Shevanne? Who is Shevanne?
Shevanne is a born and raised Nevisian. Very friendly, popular enough, I would say. I get along well with most persons. Very social. I have a passion for health. I also have a passion for just having fun and doing things that make me happy, make other people around me happy. So I would say that sums up who I am.
Okay, so you touch on the topic of health. What kind of health are you passionate about?
So I'm currently in public health, so that would encompass everything outside of clinical health. So it's not to do with doctor and medical, that kind of thing, but it's to do with basically in ensuring that the public itself is healthy, everything is done properly according to the standards of health for the island. And that would also include health promotion, which is what I do. I'm into public health promotion, encouraging persons to do the right thing to be healthy, whether it means being active or whether it means to eat healthy or just doing things that practices that encourage a healthy lifestyle. So that would be what I am into, public health.
Public health.
Yeah.
Well, on tonight's episode, the health topic that we'll be touching on is sex health, because the health promotion unit here is basically the only time me would go a health promotion unit, even growing up, when me I go look condom,
yeah,
or whenever them have something related to sex.
Right.
So in regards to sex health here, do you think we have a healthy atmosphere in regards to sex in St. Kitts Nevis?
I would say it could be better, but it's not the worst I've seen or heard of.
You have seen or heard of,
yeah.
So where else have you experienced?
I've lived outside of Nevis, so I've lived in the U.S. Virgin Islands. I've spent a while in North America, and I had the opportunity to study in Taiwan. And so I've had diverse cultures and experiences. So I could rightfully compare St. Kitts and Nevis to a few other countries. So that's why I would say it's not the worst that I've seen, but we could be better. Because this is the country that I born and raised in. This is my passion. So of course I would want the best for it. So I think we could do better sex health wise, but it's not as bad as I've seen.
You went to live in the BVI. So how long did you live there?
The USVI?
Yeah, USBVI.
Yeah, I was living there for about 8 years.
Oh,
yeah.
US Virgin. Oh, you went to the 8 years. So what did you do there? You studied there?
Mm-hmm. I studied there and then I lived there for a little bit afterwards before I came back home. Yeah.
So what were you studying there?
Biology. That's where I did my undergrad.
Girl. She not done like we. Biology.
Yeah.
Biology. All right. So then you say you went where to study?
After there?
After there.
Taiwan.
And what's the relationship in regards to sex health in BVI? Because you say it's not as bad as other places you have experienced. So out of all these places you went, which one you would consider to be the worst?
Okay, so I would answer that by saying, so St. Kitts and Nevis, of course, they're small countries, a very small country, one of the smallest countries in this part of the world. And so I would compare St. Kitts and Nevis to bigger countries, like for example, the U.S. Virgin Islands, North America. So the lifestyle is different, but it's not extremely different to St. Kitts Nevis. But of course, you have more people. you have a mixture of the Caribbean and US. So you have like two cultures combined into one. And so of course there are times where you have the worst of the mix and you have the best of the mix, right? And so if you were to compare St. Kitts and Nevis in terms of sex health, for a lot of different variables, St. Kitts and Nevis would be a little better because the numbers would look better too, right?
Yeah, but then
by numbers.
But then, alright, if 10 people is in a room, right, and 3 people die in the room, we have a death rate of 30%. Whereas if 100 people was in this room and 3 of them dead,
you still have 30%.
No, we have 3%.
Oh yeah, you're right.
We have 3%. No.
Right.
So then when you say it like that, maybe you see it more, but then it's not worse.
Right.
Is it? Because alright, even recently me see study come out say how much was the exact number them say?
Where?
People who have HIV here.
21. We have 21 active cases.
21 in Nevis?
No, I think it's Nevis.
How much in Nevis?
I don't know.
They're coming like the corona.
No man.
They're coming, you don't know about Nevis, but but then am I to be scared as a young man living here? Well, not me, but our young people like around my age group was single and they go do things. Them supposed to scared of HIV.
Yes, I want you all to be scared of HIV, so yes.
Why?
For correction, I just checked my stats. So the 21 is on Nevis. There's 21 active cases on Nevis.
21.
Yeah.
21. At 21, you saying, mama?
Yeah.
21. So, alright. So when that news initially broke, right? There was a conversation being had that the numbers in terms of the HIV rate here is predominantly in the gay community. Is that true?
I don't know if it's predominantly in the gay community here. Usually for if you go globally, it would have started in that community. So it was predominantly, I think it is still predominantly in the gay community abroad. But for in terms of St. Kitts and Nevis, I am not very sure. So I don't want to answer it and say yes, and I'm not sure.
Well, I mean, the man them have a point.
But, so, we're saying 21, the population of Nevis, I think it's 12,078 or something on that number, right? And so you had the right reaction because 21 persons with HIV in a country that's 12,000 people is a lot, right? At the same time, so when you ask me the question if we should be scared, I don't know if scared is the word I will use. I would say cautious. You should be cautious. Because when I did that, I was the one that did the article on the news piece for HIV because World AIDS Day is acknowledged on the 1st of December every year. And so we had an activity where we lit the Nevis nice sign in red because World AIDS Day is red. And so the person that was doing the news piece, she asked me for some statistics so she could do another news piece, and she did it. So I guess because I work in the field, hearing the numbers didn't do much to me, right? But when the numbers were done, when she did the news piece and it started circulating, and people sending me the video, people sending me the clip of me doing it, people sending me the snippet of the numbers, and I was like, okay, what's the big deal, right? So then it's you realize, okay, people are focused on the fact that we have 21 cases of HIV, but we've always had HIV. So what my issue was is it because of COVID, or is it because it's not you or somebody you know don't have HIV or haven't been exposed to HIV, have gotten HIV? Why people forgot about HIV? Because no matter how much COVID we get, we could get the flu, chikungunya, this and that. HIV is still here, so we still need to be protective. So I didn't even understand. I guess from a health educator standpoint, I was just like, yeah, okay, we have 21 cases. I mean, it's not like nothing, but it's like at the same time, it could be worse. The number was a lot to me compared to the things that I see going on. So
yeah, but then again, how old are you? Oh, if you're comfortable enough to tell the people like how old are you?
Why?
Maybe you have a old people perspective on things. Like maybe you look like a young person, but maybe you have a old mentality.
Meaning?
Like you said, because of the things you see going on, perception different from reality, you know.
Yeah, but what's the reason why? What is this the same reason, right? Why were you shocked when you heard 21 cases?
Because may I check it on a per capita vibe, like yo, as I said, 12,000 people live here. Zine. So if 21 away if 21 of them, because not me, I'm no yet. But if 21 people.
How are you so sure? You tested recently?
You mean?
You tested recently?
Oh, you mean?
Oh.
Of course.
Okay.
But anyways, if 21 people have HIV/AIDS, that's a high rate.
But that's what I just said. I said it's high.
Yeah, but then when we began this conversation, you're saying in regards to sex health, it's not as bad here if as out there, you know. But what I'm saying to you is, whereas it might look like it's not as bad, it is bad. Because if you check the population, going back to the 10 persons in a room versus 3, you know what I mean? Going back to that point, if you have 30% versus 3%, there's a difference. You know what I mean? So I feel like there's cause for me to be worried because me have a son.
All of us need to be worried, and you being worried is a good thing. And on top of that, added to what you just said a while ago, you would never find, I don't think so, and I don't remember seeing numbers that will reflect. I think it's that Nevis has 21 cases. Other countries have way more, and even if you do it by percentage per capita, we are not the highest.
Cool.
Right? But our numbers should still be lower because we are such a small capita. So you still have a point. But and when you ask me if you should be worried, I say it like this. When people are concerned about the HIV number, it's a good thing, because it means then that even if you've been ignoring it and you've been telling yourself that it can't be me, because a lot of young people think we're invincible, right? So even if you've been ignoring it and you hear the number, it reminds you that I still need to be cautious, because in every single time you get 15 chances, you 13 chance maybe the chance you get catch, right? And so you still want people to be mindful of the fact that get your condoms, have safe sex, and if you and your partner just with each other, then that's safe. But if you start to go outside or whatever the case may be, use protection. Because at the same time, just like how I always say this little thing, if somebody, just like how I could judge someone, not me personally, but I could judge someone for being promiscuous, right? The person could judge me for not being promiscuous. It's a lifestyle choice, right? But just be careful. So if you want to have 4 partners or 5 partners, be protective, right? So that's what we're trying to promote. So we always say the cases are the cases, and it's unfortunate for persons who were, have HIV, it went to AIDS, or persons who live with HIV, and whatever the circumstances may be that cause you to have to live your life a certain way now. These are the choices that you made that made you where you are today, right? Except in cases of persons who were raped, and unfortunately you got HIV because of that. But you still need to be cautious, because life is all about choices. You made a choice to do it, and so now the circumstances of your choice have you here. You could have prevented that just by being protective, right?
Right. You touch on the topic of rape. Do we have a lot of rape happening here in St. Kitts Nevis?
You see, the information, the data on that, we don't really get per se, and maybe I could find it, but I don't have it, so I can't say we get a lot of rape. You know, we have a few cases of statutory rape, but in terms of the actual physical rape, where somebody forced sex on somebody, I don't know the statistics on that to talk about it.
Well, for some reason, I feel like, not for some reason, for specific reasons, me feel like we have a lot of that happening here, but it's being hushed down and rather leave it alone. But back to a conversation about the HIV vibe, because it's interesting to me, you know, isn't it? So while the percentage might be low, in my opinion, it's still a lot, because when me really look on it now, you say 21, right?
Mm-hmm.
Now that number 21 there, it's all good and easy to look on it and say just 21, you know? But then when you look on it now, the 21, if one young person within that 21 there, if there is one young person within that 21 that decides to give it to another young person, the population of young people here is very small. You know what I mean? So whereas it might not be a lot, it could be easily spread amongst a small group of young people, because everybody right now around here, everybody are going with everybody, isn't it?
Mm-hmm.
So, and me can't even say protection involved. Me can't say whether or not protection, the necessary protection involved, but I doubt it. Young people, you know, and anything young people do, it's normally reckless, because, and I was reckless at one point, but I'm not there now. You know what I mean? And where I am lucky, another young person might not be lucky as me.
Facts.
Isn't it? So that's why me say me scared now, because not necessarily scared, but it's something where it kind of there in my mind, because when you look on it now, me have my son is just a year and a half I come up. Zin, what if when him reach that stage then now, the number gone from 21 to 200. That's the percentage chances of him actually contracting HIV. It increase a lot, isn't it?
Yes, but also too, it has two things. It would be, so if our education would definitely continue, and we've been educating, that's the reason why you even know that health promotion offers free condoms, right? Because you know about health promotion and we've been doing our drives and stuff. So you have persons like yourself who know, so you would educate your children. I would expect you to educate your children. So you rely on education, because that's basically how you treat a nation, through education. And then another thing is to, I don't know if a lot of young persons know this, but we also would mention this in our education. Persons who, so if you see when we have our HIV testing drives, so you come and you get tested and whatever for the day. So if you are, let's just say somebody was found that they have HIV. So that person is not left alone, So let's just say the person come, they came for the testing like they do every year, and this year it was detected that they have HIV. That person is counseled, and then you're attached to someone who gives you your medication, because HIV patients on Nevis, on St. Kitts and Nevis, they get free medication. And there's also a program for them where they get groceries and there's other perks involved. So there's a program running for persons who have HIV.
So hold on. Is there a level of confidentiality?
Of course. So the 21 persons, I have no clue who the 21 persons are. Most of the persons in public health do not know who those persons are. So the person who did, I don't know if I'm gonna use case manager because I don't remember the term. But the person who deals with these persons is very confidential, and so you would never know who the persons are. You would never know when they get their groceries, when they get their medication and stuff like that. It's dealt with, because HIV the program for HIV is very rigorous and it's very serious. And so I said that to say the medication that's given to persons who have HIV controls your viral load, and so it's harder once you take your medication on time, you do what you're supposed to do, eat, exercise, that kind of thing, whatever the regimen is. It lowers your chances of transmitting it to somebody else, because the medication basically lowers the I don't want to use too much medical terms, but lowers the whatever it would pass on to our next person for HIV. So it lowers that. So if I have HIV, if I was to have HIV and I'm taking my medication, having sex with someone, the chances of me passing it on is lower than if I was not taking the medication. And so education and the fact that persons who are on the program are taking the medication. Now saying that, the next thing too is, just like how we have not I'm gonna say issue, but just like how with how we have hypertension, high blood pressure, diabetes and other stuff, the persons with HIV, in everybody you're gonna catch it. So the 21 people that we have are persons that were willing to come and get tested, and we found out. So there's possibly, and I'm pretty sure I'm right, there's possibly more persons in the country that are positive for HIV that didn't get tested. Maybe it could be too that they are getting the medication but they go private, so we wouldn't have that information, right? Because we are getting information from a public health standpoint. The same thing for persons with hypertension, diabetes. We will say you have 300 or 200 and something persons in our registry, but I'm pretty sure there are more, because everybody comfortable going to the health center, going to the doctors, going to the the screenings that we have. So we are basing it based on what we have.
Okay, so do you think, how am I gonna put this now? Do you think it should be private or public information that people have HIV?
Definitely. You mean like listing the names of the persons?
Yes.
It should never be public information. You cannot afford, no country in the world could afford for that to be public information. You know why? The HIV comes with a lot of stigma. You have persons discriminating people lose their lives for that, a lot of stuff happen to persons because someone suspect or somebody know that they have HIV. So you as a country in charge of health, you cannot afford for anybody outside of who's dealing with these people to know that they have HIV, because you have a lot of issues. And then remember too, the Caribbean, I'm not even going to say St. Kitts and Nevis alone, the Caribbean, we're ignorant people, right? So it's like you find out somebody have HIV, one person mightn't take it nowhere because you have people who think outside the box and are more, more forward thinking, but then you have the average person who's ignorant and would not accept the fact that this person have HIV, and then you have a whole bag of problems outside of the fact that you already have the HIV problem. You have stigma issues.
But I'm not talking about those persons. I'm talking about the devious people.
Who would go out and try to have sex with people?
Yes.
Intentionally, but then how do you separate devious people from the people who are not devious? So then you have to just do everybody. You can't separate it. You can't watch a person and tell that they're devious.
Yeah,
you
but
see what I say?
But so you think, okay, so then we're banking on the fact that the percentage of devious people is significantly lower than good intentions people with good intentions.
You can bank on that. But what you can mostly bank on is the fact that the counseling that is given to persons who are detected as HIV, it works.
Counseling, yeah, but then you have people out there who say them are Christian and them go to church and get counseling from pastor and them do the opposite.
Yeah, but when I say counseling, right? So you've been to these screenings, right? Where we have the HIV screenings that you have. So you realize when you're going and you sit with the nurse and she take your thing or whatever, and she tell you come back in 15 minutes. And instead of one of us who work in the screening giving you results, you have to go back to the same nurse.
Yeah.
You know why that is? That is because if you were to be found positive, she don't leave you to go out and deal with it on your own. Right then and there, your counseling starts there, and then you attach to somebody else, because you then have to get a confirmation test to make sure that this test was right. So they double check, and if that is correct, then you attach to somebody. So when I say counseling, I don't mean counseling like when you have depressive issues and that kind of stuff. I mean you're attached to somebody medical now. to make sure that you're taking your medication, you understand what's next, you understand that you can actually live a normal life with HIV, that kind of thing.
No, man. I feel so.
You can. But you're looking at it from a standpoint of somebody who doesn't have HIV, hasn't been exposed to someone with HIV. So you don't know. But you can actually live a normal lifestyle with HIV.
Well,
close to normal, let me put it that way.
Well, then, thinking about it really, a normal lifestyle is relevant, because if me live in a depression all the time, that's my normal lifestyle.
Right. Mm-hmm.
Isn't it? So it's relative.
That's
when you really think, when you go to the base of what's a normal lifestyle, like, it's relative. So I understand what you say.